what are some of the risks or complications of non-surgical treatments, specifically injectable treatments like Botox and fillers? I'd say this is probably one of the most common questions that we get, and it's something that we spend almost as much time discussing with patients as the actual treatment. And it's partially because it's an important thing to talk about, and it's also because there are so many misconceptions out there about risks, complications, or even potential outcomes, whether good or bad. And so let's go through the common and even some of the uncommon issues with injectable treatments. So anytime you poke the skin, you have a chance that there's going to be some bleeding or some bruising underneath the skin. I would say this is reasonably common. That means that maybe 1 in 10 patients will have a small bruise at the site of the injection. This is something that often settles down within a matter of hours or days. Much less commonly is a deeper bruise that shows up as if you got hit by a softball, and that's a purple discoloration and swelling of the skin. That's something that can last a little bit longer, maybe a week or even up to 10 days. There are a few things that you can do to minimize this. So of course we use topical freezing that helps to prevent some bleeding and bruising. We also use ice packs to shrink blood vessels hidden underneath the skin. And then after treatment, you can use certain products like arnica, for example, that helps with bruising and swelling. So there are a few things that you can do before and after to minimize this already fairly rare complication. I'd say the most common, and this one relies a lot on the discussion that you have with your practitioner and how well we understand each other's goals, but that would be under or over correction. Okay, so these are tailored treatments for each individual patient, and so our goal as a treatment provider is to understand exactly what you want and to deliver that. And if we don't understand that and we don't spend enough time to feel what you feel, then we can either provide an impressive result, or maybe, and as we've all seen in the media or on TV or just walking down the street, overcorrection, where people tend to look more unnatural than beautiful. And so that's under and overcorrection, and really that is mitigated by the practitioner's skill, of course, but also that detailed discussion about your goals and expectations. One of the very, very rare, but certainly very important things to consider is injection of a product into an inappropriate location, whether that's too superficially right underneath the skin, or whether it's in or near a blood vessel, and that can cause lumpiness. It can cause an area of the skin to be damaged. There are even reports of blindness, and these are extremely rare complications, and certainly these are why we always encourage people to go to people that are trained and know what they're doing and understand the anatomy and have a lot of experience. In the hands of those practitioners, those are extremely rare events, but you should see them on the consent form that you sign, and they are something that we talk about with every patient, however rare they might be. In general, thousands of these treatments are provided every month and every year in many clinics with well-trained people across the city, and the complication profile is exceedingly low and patients are extremely happy, but it is something that we spend a lot of time dealing with, and I hope that some of this will help you. Again, if you have questions or comments specific to complications from injectable treatments, I'd love to see them below and I will try to specifically address them. See you again soon.